So, do you work in the NICU? Are you a nurse, a practitioner, a student, a resident, a case manager, a speech therapist, a respiratory therapist, a neonatologist? Do you come into contact at all with parents of NICU babies? If you do, then this list is for you and for me. Hi, I'm Dr. Tala, and I've been a neonatologist for about 16 years now. And apart from 3 pretty brief maternity leaves, I've worked pretty much non-stop in very busy units. I've studied very hard, I've gotten good grades like a lot of us, I've had fantastic teachers and mentors, I care a lot about all the babies that I take care of, but I know that I've made mistakes when I speak to parents and family members. But after sleep and support, I've tried to take those situations and to learn from them. And really, this is what this video is about. It is in no way me saying that I am always right, because like I've already said, it definitely isn't that. But I feel like a lot of things that were taught in this video are very helpful for all of us. They were very helpful for me too. The other caveat is that this list comes from women physicians who had babies that were in the NICU. So it really is a very select socioeconomic and educational group. So if you feel like there's anything that you would like to add to this list, then please do comment at the bottom. Number 1, it's a roller coaster. One mother said that she hated this so much that literally every time she heard it, she wanted to scream. We've all used this expression and we know why we use it. We're trying to point out that the NICU is full of lots of ups and downs. But as this mother pointed out, there is literally nothing fun about the NICU and nobody would ever sign up for the NICU. So it's a really weak analogy. She added that it's a completely overused and weak saying, and every single person that said it acted like it was the first time that it had ever been said to the parents. So, noted, we should probably not use the term roller coaster and maybe just emphasize that a NICU has lots of ups and downs. Number 2, I just finished her cares. Many mothers complained about this. One mother called me directly once sobbing because she was so upset that she didn't get to take part in the baby's cares. So normally what the situation is, the mother is calling and she's telling the nurse that she's going to be there in a few minutes or at whatever feed to start doing the cares. And then sometimes there'd be a few minutes late or sometimes even early, one mother said a couple of minutes, and the cares had already been started. So things like checking the temperature, changing the diaper, starting feeds, whatever else needs to be done for the baby. I don't work at the bedside, but I totally get this one from both ends. Nurses are super busy anyway, but sometimes different things happen. Maybe the baby woke up screaming and was hungry. Maybe the baby had a blowout diaper. Maybe 23-week twins are about to be delivered and the nurses have to make sure that all the other babies are tucked in before there's chaos at the other end of the unit. Sometimes mothers say they're going to come in and whatever happens, and they literally don't come in, or they come in 2 hours late. So the nurse isn't always sure if this is going to happen that day or not. But on the other side, it's also a really big deal for the mother to come into the hospital. And obviously she wants to do that like one thing that she can really feel like she's helping with her baby. So the mother has to like plan her entire life so that she can come into the hospital. She's driving there or taking public transport. She may have to find parking, maybe pay for the parking. She has to come up, scrub into the unit. So imagine after all of that, getting there and realizing that everything's been done and they've already started feeding your baby. So honestly, and again, I don't work bedside, I don't know what the ideal solution is here. Maybe choosing a cutoff time that if the mother's any later than that, then we're going to have to start cares, or agreeing under which situations the cares would be started early. For example, if the baby is crying out in hunger. Number 3, he's just so small. One mother said that in the beginning, when people said this once or twice, it actually felt quite nice. But then when people kept repeating it over and over again, it really began to hurt. One mother said that she felt it was her fault that the baby was so small because she did such a terrible job at staying pregnant. So this is interesting. We always think that we're saying it in a so kind of like, oh, the baby's so cute and adorable way, whereas it could really bring out feelings of guilt in mothers. Honestly, I've never really thought about it this way, mostly because I know that nearly all the time it's nothing that the mother did or didn't do that resulted in her baby being in the NICU. Most of the time it's just really bad luck. However, I do know as a mother that whenever anything goes wrong, I automatically feel guilt. So this just does kind of frame that in a slightly different way. Number 4, your baby isn't in this bed space any longer. We all know what this is like. Sometimes we have to move babies in the NICU because of ease or because of staffing or because one of the pipes burst or something somewhere. And so obviously sometimes babies do have to be moved. And obviously we should always call the parents when the babies are being moved, but sometimes this falls through the cracks. Maybe the parents didn't answer immediately. Normally we're moving babies when we're at our absolute busiest, when we've got like triplets or something that we've just admitted. And so we don't have the time to carry on trying to let the parents know that the babies have been moved. So I can't imagine how terrifying that is for parents that they turn up and they're told that their baby isn't in that space any longer. But even if parents did know about it or do know about it, it really does kind of throw off their routines. And that is one of the things that parents need while their babies are in the NICU. A routine with the time they come in and the way that they're feeding the baby and the nurses who are taking care of their baby. And those routines add some sort of normalcy to the lives of both the parents as well as the babies. I'm not really sure what the answer is to this one either. Obviously, babies are going to have to be moved because of staffing or whatever else. And so obviously we are going to disrupt the rhythm for parents. The way that I try to deal with it is I try to frame it in a really positive light, that we're moving babies because they're now healthier. Which is very true. We would never move a 22-weeker or we'd never really move a baby on ECMO for staffing or whatever. Number 5, she's a sick preemie or she's just so sensitive. Nobody wants to hear this. One mother said this was constantly used as a reason for why everything was going wrong. Like it was the baby's fault that the baby was so small and so sensitive. We can all understand why anybody's saying this because we want to constantly gently remind parents that the babies have a long way to go. Obviously, though, there is a different way to do this. There's a gentler way to do this without making it seem like the baby's struggling at every single minute of their lives. Number 6, your breast milk is not good enough, which is why your baby is too small. I've definitely said something along these lines when I'm trying to explain that breast milk is not enough calories, protein, calcium, phosphorus, whatever, for premature growing babies. And yes, I guess after reading that, it is pretty easy to understand how mothers could internalize that and kind of make that their fault as well. So I guess the key thing here is just reframing that and emphasizing just how amazing mother's breast milk is, really for most of the nutrition, for probiotics, for the immune factors, for enzymes, for a whole host of things that we probably don't even know about. And yes, for ideal growth and development, we need just a little bit of extra calories and protein and whatever. Number 7, you're stinky or you smell terrible. One mother said that she was really proud that her baby's bowel was working and that the baby was producing bowel movements, and she didn't want some random person to tell her baby that the baby was stinky. Again, mother said that at the beginning it was kind of cute, but listening to the same thing over and over again became irritating and then eventually just offensive. I don't think we need to go over this more. Just the point that parents see a lot of us in a day. So even if we think that we're saying something cute or they're only hearing it once, if parents are hearing something over and over again, especially if it's a little bit negative, it can come off as really grating and just flat out offensive. 8. Wimpy white boy syndrome. There were lots and lots of statements, negative statements about this phrase. And honestly, I'm not really sure why we still use it. And we really do still use it. Even if we're not using it in front of parents, we still use it with our colleagues and everybody else that's taking care of the babies in the NICU. I've been in the NICU and mothers have actually offered that phrase to me, like in a really casual way, as if it's the baby's diagnosis. And then I don't really know how to actually react to them. I've had mothers that have come back to NICU reunions and just told us how much they hate that phrase. One mother said she hated that phrase so much because she saw her baby as a fighter who had triumphed despite his prematurity and low birth weight. And she felt that giving him that label had really minimized everything that he had gone through. I think the other thing that we can take from this is that when we say something to parents about their baby in the NICU, it doesn't mean that that is going to characterize their baby for the rest of the baby's life. I know that this is true as a parent. Somebody tells you about a personality trait or something in one of your kids, and immediately you start thinking that that's what they're going to be like for the rest of their lives. A long time ago, I was at work and a colleague of mine got called because her 18-month-old had bitten somebody at daycare. And we talked for hours about how this could or could not affect this kid in the future. She had this whole image that her son was going to be in jail for being so violent when he was in his 20s. Obviously, none of that is true. The son now is in high school and he is the kindest, best kid ever. I think maybe this happens a lot in the NICU. We'll tell parents that their baby is a poor feeder at that moment, but in their heads, they're imagining the baby at 15 years old and he's still not completely coordinated as he's going out to dinner with his friends or whatever. And I think that's probably part of it with wimpy white boy syndrome, that when we say it, or hopefully we're not saying it, but when the parents hear it, that they're not just imagining that brief period of life that the babies are going to completely get over, but they imagine that their son is going to live the rest of his life physically, mentally, emotionally weaker than his peers. Not a good thing at all. Number 9, you've got PTSD. When somebody complained about a legitimate concern. And this was repeated several times by many mothers, and it all comes down to the fact that they felt that we all weren't necessarily listening to them when they were genuinely concerned about something. So this is a tough one. We all know that mothers have fantastic intuition. So if they feel that there's something wrong with their baby, then there very well might be. But we also realize that mothers are terrified, and part of our jobs is to actually offer reassurance when we really don't think that there is anything wrong. And sometimes it's really hard to get that balance between the two, and I don't really have the answers, but maybe it's some sort of combination between the two. Something like, it's normal for a growing preemie to have an occasional event, but if the events do become more frequent or severe, then we'll definitely escalate care. Number 10, a chronic lunger. The mother that said that her baby was being referred to as a chronic lunger also said that basically anytime anything went wrong with the baby, then they blamed it on that, and it was just like this confirmation bias. This goes back a little bit to what we were saying about the wimpy white boy syndrome, that as soon as we have a diagnosis like that, it's very difficult to see anything beyond that diagnosis. Obviously, this is not something we should be doing in medicine at all. We don't say the Down syndrome baby, we say the baby with Down syndrome. And it might not feel like a very big difference, but truly it is the difference between making that diagnosis their whole existence or not. 11, you're not spending enough time with her. Or if you were here more, she'd be feeding better. Or I haven't seen you in the last few days. And by the way, the mother that said the last one also said that it was said to her without acknowledging the fact that she basically only missed 3 days out of the 63 days that her baby was in the NICU. All these statements, even if they weren't meant in this way, made these mothers feel judged. And even if they were doing an absolutely outstanding job at being mothers for NICU babies, they still felt guilty. I'm sure everybody can understand how difficult and offensive it is for any mother to hear these words. And here we're not talking about mothers that don't visit and don't call all the time. The mothers that are genuinely absent, those do need different conversations, like, what's going on with your lives? Do you have transport issues? Do you have phone issues? Is there anything that we can help you with? In this specific situation, we're talking about mothers that do come to visit all the time, but are also trying to balance out all the other stresses in their lives. I also think that sometimes we don't know how offensive what we're saying comes out to somebody. So for example, if I haven't seen a friend in a few days, I'll casually say, oh, I haven't seen you in ages. Obviously, if I'm saying that to a mother in the unit, that's going to come off very differently. One mother said that literally every single mother she knew in the unit was trying to do their best. So we should all refrain from finger pointing. And I'd also add, and what I take from this, is that we have to be extremely careful with exactly the words that we use so that they can't be interpreted negatively at all. 12, who are you? Many mothers agreed how offensive this statement is. Many mothers said they've walked through the unit hundreds of times. They could basically identify most people in the unit, and sometimes they were still asked, who they were or which baby was theirs. Obviously, many units have badges or stickers or some form of identification that kind of helps decrease this issue. But a lot of times we're asking this question just out of safety. I mean, we've all heard horror stories of babies being taken from the unit. Again, I'd just like to add that there's definitely a way of saying this to the parents so that it doesn't come off offensively. Even if it's acknowledging the fact that you've seen them before, but you can't quite remember whose parents they are. 13, we're staying the course for the weekend. Or on the weekend, we don't adjust anything. We're waiting for the return of your team on Monday. Again, these were physician mothers who pointed out all of these phrases, so they were all perfectly aware that good medicine should happen on the weekends too. And that's not to say that we're not giving good medicine on the weekend, but as we all know, a lot of the NICU course for a lot of babies is just time and growth. And it's not like those things aren't happening on the weekends. Just because we're not getting labs or we're not following up with different imaging or whatever, it doesn't mean that we're still not taking good care of the babies. So I think this also comes down to kind of a wording thing, to emphasize the fact that we still do care and we are actively taking care of their babies over the weekend. 14, it's like free babysitting, or you should be happy that you can sleep through the night while your babies are in the NICU. Like many things, I'm sure this wasn't said in any sort of evil way, and it was probably something that a lot of us have kind of said some variation of in the past. We're all just trying to give a silver lining while the parents are going through this horrible stage of their lives. So again, this is probably a wording thing, if it needs to be said at all, that hopefully the parents do have some time to rest without any implication that this is a vacation or free babysitting for them. 15. So this is what's happening with your baby. A lot of mothers said that many providers just launched into what was going on with their babies without introducing themselves, even if they'd never even met the parents before. So just as a reminder, parents see many nurses and respiratory therapists and providers and a host of other occupations all day long. And we're basically all wearing scrubs as well, so it can be very confusing who they've met or not. So unless you are 1,000% sure that the parents know who you are, just introduce yourselves again. By the way, if you all want to know something about me, this is probably the only item on the list of these things that I've never done. And that is because I have some level of facial blindness. I am awful at recognizing people. My husband finds it hysterical, but sometimes I don't understand movies just because I don't understand who's the good guy and the bad guy because they look exactly the same to me. It's not a good trait to have at all that I can't recognize faces, but because I'm so bad with faces, I think I just kind of assume everybody else is as well. So I pretty much introduce myself every single day to families. And sometimes like the parents will be like, are you joking? Like we've seen you for like 3 months straight. You're basically part of our family now. 16, I had the worst date last night. Okay, for full transparency, I made up that phrase, but basically it was the general sentiment of many mothers. That oftentimes the unit just got too bright and too noisy, and that a lot of people working around the babies were just really chatty and really loud. Whereas all the mothers are heartbroken and tired and not feeling cozy enough as it is, and they don't really want to hear about somebody's bad date or how bad their weekend was or how great their weekend was either. And they added there's already enough noise with all the beeping and the moving the babies around and all the other families and everything in the unit. So adding even more noise to that is not great. Also, working in the unit, I realize how important it is to make our connections with our colleagues, to have conversations that aren't necessarily anything to do with the babies. That really does help build morale, it helps the culture of the unit, and it really does prevent burnout. But as we all know, there's a time and a place for everything. Okay, that was the 16. There were a few more things that were listed to me, whether it was from mothers in the NICU or, like I said, this list of physician mothers, but these were the ones that were mentioned the most frequently. If you are a mother or somebody that works in the NICU, what would you actually add to this list? I'd really love to know. And so please let us know whether you email or whether you comment below. In the meantime, if you reach this far, please like this video And if you're interested in neonatal education and stuff, then please subscribe to the channel. And also let us know where you're from. It is so great having you here. Thank you.